Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.
And joining us live in studio is Dr. Mark Hiatt, Executive Medical Director of Regence Blue Cross Blue Shield of Utah. It's always good to see you, Doctor. We've got great topics right now. And November, of course, is Family Health History Month. And we want to talk to you about why it's so important to know our family's health history.
Amanda, many people have certain diseases that may run in the family, like diabetes, cancer. And it's really important to know what your family health history is. Because if you know your past, you may be able to take steps to improve your future.
What components make up a family health history?
A family health history is a record of the diseases and health conditions in your family.
Okay.
It's good to have 3 generations of your biological relatives, to know them, to know what health problems they may have had, and the ages at diagnosis.
So I'm thinking, maybe not at the dinner table, but everybody's going to be together at Thanksgiving. This might be a good time to get some information.
Maybe chat about some of that.
Maybe not over the pie, but maybe before or after the feast to bring up this conversation, because it really could improve your life and those of your family members.
There are some people that might have some major questions, and there's a website that would be a big help, too.
Brian, the Utah Department of Health has a tool. It's at their website, cancerutah.org. That's cancerutah.org, O-R-G.
Okay.
That can help you collect your family health history and also guide you in those conversations that may be needed.
Yeah.
I want to talk about children and opioids, because we've talked a lot about the opioid epidemic, but does it affect, I guess I shouldn't say it in the definitive, does it affect children as well?
Yes, like adults, children may need pain relief after their surgery, say when their tonsils or adenoids are taken out. In fact, a new study published just recently found that children are prescribed the opioid codeine probably more frequently than they should be.
So what's the problem then with codeine?
Well, Brian, codeine is converted in the body by an enzyme into morphine, and that's when it becomes effective. The problem is that 1 to 2% of children are what they call ultra metabolizers, which means extremely quickly they make this conversion such that they can actually be at risk of overdose.
So what's the alternative to codeine then?
Over-the-counter Tylenol and ibuprofen in alternating fashion may be the best first-line medications for pain that is mild or moderate, really reserving opioids like codeine for more severe pain.
So what about like headaches and things like that in kids? What do you do with that?
Well, even before the Tylenol or Motrin, I'd try some form of distraction or tension relief. See if first you can take away the offending problem, which may be in the case...
So a screen, probably.
Yes, in the case of many children, a screen, whether it be their tablet or the TV.
Because I do have a son who gets headaches once in a while, and I wonder if it's that he's on that device too much.
Maybe playing
Maybe
too many
try
games.
something else, like try a game that's not on a screen but rather on a court.
Brilliant.
Or get outside, get in the car, drive around, look at the leaves, actually look out the window. That could help, too, I would think.
Can we save this last topic for another
let's do
day?
it.
Because
That's
I
great.
love that Americans are drinking less soda. I think that's fantastic.
Good news.
Yep, that's right.
This portion of Utah's Morning News brought to you by Regence Blue Cross Blue Shield. Happy Thanksgiving to you, by the way,
Yes,
Doctor.
indeed.